A lot of the time we think that pain intensity and injury severity are the same thing, but does pain always mean tissue injury? In this episode, we're going to discuss pain. Well, it would be nice if pain intensity and pain severity were closely correlated, meaning that the more pain you were in, the worse the injury was. It doesn't really seem to be the case. So the example I always give is when you have a paper cut. We've all had them and they really hurt, right? But the amount of tissue damage actually with a paper cut is actually pretty small. It generally heals within a day or so. And so it's a good way of kind of looking at it and saying, well, if the pain severity meant it was a really bad injury, a paper cut would be a really bad injury, but it's not. The other example I use is a broken arm. So of course it hurts when you broke it. So if you fell or got hit or whatever, it generally hurts when it happens. But as soon as you're in the cast, the pain typically decreases if you feel pain at all while you're in the cast for the 6 to 8 weeks. I know when I broke my thumb, I was in a cast, and while I was in the cast, I didn't really have any pain unless I hit something with the cast or something like that. But the point being is that there's tissue damage. The bone's still broken while in your cast, but there's not much pain, so there's not a good correlation between pain intensity and injury severity. And this relationship between pain and injury decreases over time. So initially, pain can give some indication of what's going on. So when we broke our arm, yes, there was some tissue damage. The pain's telling you, hey, something happened in the arm. But as the pain persists for a long period of time, that relationship decreases. So when we look at either like persistent low back pain, where someone has had low back pain for over 3 months, or maybe persistent shoulder pain, where we have rotator cuff pain for 3 to 6 months, tissues heal. So if there was an initial injury, those tissues should have healed somewhere within 6 to 8 weeks. Some tissues take a little bit longer, but if we've had pain for over, let's say 3 months, 6 months, something like that, the pain state has less to do with the actual tissues and more to do with protection. If you think about it, pain is one of the best ways to make you stop using an area so you can protect that area. So if the brain thinks that we're at risk or we're threatening the health of our low back or our shoulder, well, if it generates pain, then we'll stop using it. So a good example would be if you were at the gym deadlifting and you're pulling and then you felt a pop in the low back and you had a lot of pain. You let it heal for a little bit. We'll say we're 2 months out, but we're still having some recurring pain. And generally it happens if we're bending down to pick something off the ground, tie your shoes, anything like that. That probably has more to do with your brain trying to protect that low back than it does with the tissue states of the low back. So what your brain is doing is basically looking at the movement and going, I remember, last time we were bending over in this position, we injured ourselves. So I'm going to generate pain because I don't feel safe doing this movement, and that'll make you stop doing the movement. And that's a great short-term protection strategy, but not a good long-term protection strategy because you have to bend over, you got to be able to move. So it's a state where your body's become sensitized to that movement. And what do I mean by it's a sensitized movement? Well, what happens is that in the beginning, pain is generated and modulated in the brain. So what happens is that your tissues can send up danger signals, which is called nociception. So they go from your tissues up to the spinal cord and up to your brain, and then your brain ultimately decides whether you're in a threatening position or not. So it can then decide whether pain is appropriate in the first place and also how much pain it should generate. So in the case of the paper cut, your tissue is actually broken, and so especially because it's on your hand and you have more reception in your hands, well, your brain says, ooh, the skin is broken, we're worried about an infection, I want us to be aware of this because we need to protect it so that A, it doesn't get infected, and also so we don't use it. We know that it's there, let it heal, and then we'll be okay. We can also have the flip, so instead of just increasing sensitivity, we can also decrease sensitivity as well. So If we look at, if you've ever had a bruise, let's say, right? But you don't remember how you got it. You just look down on your leg and you're like, where'd that bruise come from? Well, bruising is a signal that you have some sort of tissue damage. There's pooling blood there for some reason. But if you don't have pain, if pain and injury were 100% related, well, you should be in pain because of that bruise, but until you looked at it, you didn't know it was there. So the brain didn't think that whatever you did, whether it was when you hit the coffee table or, maybe you were playing soccer and the ball hit you in the thigh, your brain didn't think that that was a threat to you, so it didn't generate pain. Another example of this would be osteoarthritis. Most people have arthritis because it's more related to age than it is to any sort of other metric. And because arthritis occurs at such a slow rate, the brain doesn't typically take note of it. And so you can have late stage osteoarthritis where you take an image of the knee or the low back or something like that and you see osteophytes, bone spurs, all this stuff in the joint, but you don't really have any pain, and it's because your brain didn't think it was a threat. And honestly, it's not really a threat, it's just your body reacting to loads over a long period of time. One of the best ways that I've found to describe this pain hypersensitivity is to give you an example. So let's say there's a coffee shop that we go to all the time. You're walking to it, you generally don't think anything about your walk to the coffee shop. You go in, you're really happy because you're getting your coffee, and then you leave. Now, let's say one time somebody robs you as you're going to the coffee store, right? They stole your wallet. The next time you walk towards the coffee shop, you're going to be a little bit more vigilant, right? You're going to be looking around, you're going to be checking every alley, every little place, and you're going to be looking at everybody as a potential threat. Even though the person who stole your wallet, they're not there anymore. And that's hypersensitivity. There's no threat there anymore, but your body's reacting like there's still a threat. And so with pain, your body reacts in the same way. So whether there was an injury or not, your body is trying to protect itself by being hypervigilant with movements that are similar or situations that are similar to the potential injury. And I'll make a separate video on the approach to overcoming persistent pain, but basically what you would do is that the same thing you would do with the coffee shop. You would just kind of keep going. In the beginning, you would be very vigilant, you would look around, you would, you might not bring that much money with you, you might only bring enough money for coffee, whatever it is. And then over time, eventually the threat level decreases and then you don't think about it anymore. So a couple weeks later, a month later, whatever it is, you don't think about it anymore and you just are back to your normal routine. So when we look at pain and rehabbing from a persistent state of pain, we take the same approach of just gradually exposing people to whatever is causing the pain, and then eventually they become desensitized to it.
Thank you guys so much for watching another episode of Monday Mornings with Michael. I hope that you guys found this information useful. If you did, please like this video and don't forget to subscribe. Until then, I'm just going to hold this plank until you go ahead and push subscribe. Go ahead and push subscribe. I don't know how long I can hold this plank. Just click that button right there.